Hello and welcome everybody to the Biogenetics Metabolic Clearing Program. I'm Dr. Watts for Biogenetics. I'm a doctor of chiropractic and an expert in functional medicine and clinical nutrition. Today what I want to do is I want to show you how we start with most new patients. When we're serving patients that have chronic disease, whether it be obesity, diabetes, thyroid conditions, autoimmune disease, gut problems, whatever it is, if it's chronic in nature, we want to make sure that we support your body's ability to get rid of inflammation first and foremost. One of the key things to understand before you start your 21-day metabolic program is really how lifestyle works. So chronic disease, chronic health outcomes, how you feel right now is the sum of your DNA, so your genetic blueprinting, and the lifestyle that you have it living in. DNA plus lifestyle. It doesn't happen any other way. Let me say it one more time. Chronic health outcomes are the sum of your DNA plus your lifestyle. So that means right now, if you don't feel well, if you don't feel the best that you can possibly feel, if you're tired right now, if you have fatigue, if you have insomnia, if you're somebody that's living with chronic muscle pain, if you're somebody that has a little bit of weight to lose, maybe you need to regulate your blood sugar. Maybe your bowels need to shape up and start moving the way that they're supposed to. Whatever it might be, if it's chronic in nature, we have to look at it through the lens of lifestyle. The 21-day metabolic clearing program is really a jump start for you and your lifestyle. And it can help us build one that's compatible with health and healing. Because after all, if we're looking at DNA and lifestyle being the thing that's giving you your chronic health outcomes, only one of those things is going to change. It's either your DNA or your lifestyle. So building a lifestyle that's compatible with health and healing really becomes the thing that most patients are after. It also happens to be the thing that functional medicine providers, nutritionists, nutritional therapy experts, it's what we're after as well. It's what we like to help patients customize and build from the ground up. So the question is, how does it work? How does a 21-day metabolic clearing program actually take somebody and push them down the road toward wellness at a faster rate than they would be able to otherwise? Remember, one of the key things in dealing with chronic disease of all kinds is really organizing how your body deals with inflammation. Inflammation can be looked at as static. Static, like if we have two people talking and the radio static turned up real loud, you won't be able to hear them talk. That same thing, that same principle happens between the different systems of the body. Our job, and really what the metabolic clearing program is designed to do, is to help your body get rid of that static. So you have three main detoxification systems in the body today. Three main ones. You have your kidneys, your liver, and your skin. So all of the trash that's in your lifestyle, whether it be the chemicals in the food you're eating, air you're breathing, heavy metal in the groundwater you're drinking. Technically, inflammation is the result of stress, whether it be mechanical, chemical, or psychological stressors. Inflammation is a good thing when it's balanced. When inflammation becomes chronic and out of control, that's when we start to see chronic conditions show up. That's one of the root issues in serving patients with diabetes. It's one of the root issues with autoimmune conditions. It's one of the root issues with weight gain. In targeting inflammation, it's very important to promote proper detoxification. Without proper detoxification, your body's ability to handle inflammation takes a massive nosedive. And ultimately, we start to see those chronic diseases creeping into focus. With the three main detoxification pathways that your body utilizes, your kidneys, liver, and skin, it's important to support their ability to clean up inflammation at a faster rate than it would if you just left them alone. The Biogenetics Metabolic Clearing Program supports your body's liver in its ability to detoxify. By supporting phase 1, 2, and 3 liver detoxification, really what we're doing is we're increasing your body's ability to get rid of the chemical stress that causes inflammation. Remember, mechanical, chemical, psychological. Phase 1 and 2 liver detoxification obviously take place in the liver. What these two phases do is they push a chemical transformation that allows the trash on the inside to get dumped into bile, and then phase 3 allows that bile flow out into the small intestine. So phase 1, 2, and 3 basically are an exit strategy for the chemical stress that your body is living under. Now, it's important to note here that you also want to make sure you're identifying exposure to chemical stress. You have to eat good food. You have to be breathing clean air. You have to be drinking clean water. If the exposure to chemical issues is stronger than your body's ability to clean it up, it begins to compile. Your detox pathways begin to back up, and you start to see the results of that in your physiology. It might be weight gain. It might be fatigue. It might be headaches. So as we look at how to unwind this thing that's gotten wound up, an inability to control inflammation, we want to make sure that supporting phase 1, 2, and 3 liver detoxification mechanisms is easy. It's something that you can do at home, and it's repeatable results. Quick side note, as you're working with your provider on this 21-day metabolic clearing program, understand that it's not a weight loss program. We're not trying to cut calories. However, the natural result of increasing your body's ability to dampen inflammation is weight loss. You can expect 7 to 10 pounds over the 21-day process. Sometimes people are a little bit stronger than that, but 7 to 10 pounds is about average. All right, let's dig into it. Let's talk about opening up the box as it gets shipped from either your provider or from the biogenetics warehouse. When we open up the box, you're going to have both kits and then a silver pack that's cold. If it's not cold, don't stress out. These products can last for up to a week at room temperature. What I would do is when you get this, open it up, pull the little ice pack out of here, take the products and go put them in the refrigerator, and all is well. Make sure you don't throw this part away. It's not trash. There's product in there that you need. We're going to start with the Deluxe Metabolic Clearing Kit here, as this is the way that we would start the program. Deluxe kit followed by a basic kit for your 21-day metabolic clearing program. When you open up the Deluxe Metabolic Clearing Kit, what you're going to notice is that there's an instruction booklet on the top. This instruction booklet is going to be a very helpful guide for you. Not only does it tell you what products you're going to have in the box, it's also going to tell you how to use them. It's going to give you some recommended eating guidelines and then some sample recipes. The sample recipes are not the only thing you can eat. As long as you follow the recommended guidelines, you're going to be just fine. You can create and customize your own recipes at your discretion. Now, as you are digging in here and we open up, you're going to notice that there's something called Metabo Clear Powder. It comes in chocolate or vanilla, and you will have ordered that specifically with your provider. We also have something called Biolade, Super G Antioxidant. Just going to unload all these here. HepatoCL and MDS. These products make up the bulk or the base of what we're going to be working on with this metabolic clearing kit. In addition to these products, you're going to find Biogenetics has also shipped with the Deluxe Metabolic Clearing Kit some liposomal products. A liposome is essentially a bubble that we wrap nutrition in, which increases the absorbability and cellular uptake. Essentially, that means better results faster, so that we don't have to mess around with lower levels of detoxification than what's ideal. The nutrients in the Deluxe Metabolic Clearing Kit that use liposomal delivery technology: vitamin C with R-lipoic acid, which we'll talk about in a minute; Bio-G-Max GSH, which is a glutathione, your main detoxification chemical that your body creates; and then also one called Bio-G-Max PC. And you can see the condensation here from keeping these cold. Again, once you get them, drop them in the refrigerator. As you take your instruction manual for the Biogenetics Metabolic Clearing Program, you're going to note that it does lay out the dosing strategy for each of the nutrients. What I like to do is take a marker, a Sharpie, and write on the cap how many of them you're supposed to take at each meal. Let's start with Super G Antioxidant, 1 per meal of the Super G Antioxidant. Super G Antioxidant is a very robust antioxidant formulation. It does contain glutathione, which is the chief detoxification chemical that your body makes, and also some building blocks for your body to make its own glutathione ongoing. Next, we have MDS. MDS supports a process in the body called methylation. Methylation is part of that phase 1-2 liver detoxification combo that I mentioned before. With MDS, you can take 2 capsules per meal. HepatoCL stands for clear, is one of the main components to the Biogenetics Metabolic Clearing Program. This product you can take 2 per meal, and it does serve as a support structure for phase 1 and 2 liver detoxification once again. Biolate is the next one. Biolate supports your body's ability to not only form bile, but actually move bile up and out of the liver and gallbladder into the small intestine. If you can't make bile, you can't get rid of all of the detoxification products that your liver has just made. When you can't create bile, it gets pretty messy pretty quickly. So with Biolate, we're going to be taking 2 per meal as well, and you can write that on the cap. Next, we have a product called BioGmax PC. PC stands for phosphatidylcholine. Phosphatidylcholine is a key ingredient in actually making bile. It forms the fluid part of bile that allows it to work its way into the small intestine. It's so important that your liver will donate its own cell membrane, phosphatidylcholine, in order to create bile. Remember, if you can't create bile, you can't detox. This is a key step in that process. With these liquid formulations, I'll typically write on the label the dosing strategy. With phosphatidylcholine, the BioGmax PC, we're going to use 1/2 teaspoon twice a day for the first 7 days, and then increase it to 1 teaspoon twice a day for the remainder of the bottle. Next, we have BioGmax C with RLA. It's a vitamin C wrapped in a liposome. Also included in this vitamin C product is something called R-lipoic acid, a very strong antioxidant that basically helps us vacuum up inflammation. With the BioGmax C, we're going to use 2 pumps 2 times a day for the first 7 days, and then move to 4 pumps twice a day for the remainder of the product. The last liposomal that I'd like to show you with the Deluxe Metabolic Clearing Kit, the first part of our 21-day metabolic clearing program, is something called BioGmax GSH. GSH is glutathione. It's your body's chief detoxification agent, and it's something that we use very strongly. Supporting optimal levels of glutathione is key in driving detoxification reactions. With BioGmax GSH, you're going to take 2 pumps twice a day for the first 7 days, and then we'll increase it to 4 pumps twice a day for the remainder of the product. It's imperative to note that with each of the liposomal formulations, the liquids, you have to hold them in your mouth between your cheek and your gum for 60 to 90 seconds. What happens is the liposomes begin to work their way into your bloodstream through the layers of the skin in your mouth so that you don't actually have to digest them in order to get value out of them. It bypasses traditional digestion techniques and essentially is as close to IV therapy as you're going to get in your own home without using needles. It's also important to make sure that you're using the liposomals first thing before your meals in the morning, and then also use those liposomals right before dinner time. It's not a problem if you forget, simply add them in and you should be good to go. The next piece of the puzzle is understanding the dosing strategy for the MetaboClear powder itself. This is a pea-based protein powder, and it's been mixed with herbs that have been shown in the medical literature to drive phase 1, 2, and 3 liver detoxification mechanisms and ultimately give your body the assist in handling inflammation. The dosing strategy for the MetaboClear itself is tiered. That means we're going to start out with a lesser dosing strategy, increase into a detoxification phase, and then taper off at the end again. With the MetaboClear itself, it's important to note that 2 scoops is going to be 1 shake. 2 scoops, 1 shake. On days 1 through 4, you're going to be making a 2-scoop shake once per day. Ideally, this happens early on in the morning before you begin your day, and that way we have the nutrients available all day long while you're trying to detoxify. As you open up the MetaboClear itself, it's important to note how to use the scoop. So you're going to need a fork, take the top off, and then use that fork to dig out the scooper here. And you'll note that the scoop has a line on it. A full scoop is up to the line, not up to the top of the scooper. So make sure when you're looking at this that you are following the line guideline. Next, you're going to need a shaker bottle, and I have a lovely pink one here for demonstration. And you're going to take 1 scoop up to the line, dump it in. Another scoop up to the line, dump it in. Mix this with 6, 8, 10, 12 ounces of water, however you prefer to make it. As far as thickness is concerned, I like about 8 myself. If you need to, you can also use unsweetened almond milk to make this more like a milkshake rather than a water-based shake. Either way, it's up to you. About 8 ounces is perfect in my book. So quick recap, days 1 through 4, you're having a 2-scoop shake once per day. Days 5 through 7, we're going to have that 2-scoop shake, 1 in the morning and then 1 before dinner time. As we start to drive up the intensity of the detoxification that's occurring, you'll note that your body may start eliminating water and stool at a faster rate. This is a normal response. If the detoxification situation is happening too fast, just make sure you let your provider know, and they'll typically slow down on the dosing strategy. Now, days 8 through 14 are actually the detoxification portion of this metabolic clearing program. On these days, you're going to be using a 2-scoop shake before breakfast, lunch, and dinner. So that's 3 shakes per day. As we step back from the detox focus period of this program, into days 15 and 17, we're going to go back down to a 2-shake per day strategy, 1 before breakfast and 1 before dinner. That leaves us with days 18 through 21, where we're back down to 1 shake per day. And again, you can use this before breakfast. Note that as you go through your metabolic clearing program, you will finish up some products before others. Because we start with a deluxe metabolic clearing kit and then move to a basic metabolic clearing kit, you'll have powder and capsules essentially throughout the entire process, but some of the liquids you will finish up before the end of your 21-day program. It is designed that way. It's designed to give your body the assist during the detoxification, build up, and then to wean off of those products as we go. At the end of your 21-day program, you will have some residual product left over. Ideally, what happens is you have a 1-week period for you and your provider to change your dietary intake. Next, let's talk about the food. The food that you're going to be using on the 21-day metabolic clearing program is essentially a fat flush. I want you to think about this food as an anti-inflammatory dietary regimen, something that's going to help promote health and healing rather than promote chronic disease. We're going to avoid most of the common allergens, most of the common situations with food that drive inflammation. We're going to avoid dairy, we're going to avoid eggs, we're going to avoid gluten. We're going to avoid all grains, tomatoes, tomato sauces, corn, white potatoes, peanuts, peanut butter, soy products, beef and pork, cold cut meats like sandwich meats, alcohol, caffeine, and fruit juice. And you might say, Dr. Watts, what in the world? What am I going to eat? And I just have to let you know, it's easier than you think, and you're going to be eating real food. Next, we're going to talk about the foods to eat. Make sure first and foremost that you're drinking plenty of water. In order to get rid of inflammation, we have to flush it out with water. Half of your body weight in ounces is the recommendation here. So if you weigh 200 pounds, please drink as the upper end, 100 ounces per day. Now, if you're not used to drinking half of your body weight in ounces of water per day, do note that you will be urinating a lot. You're going to spend a lot of time in the restroom, and that will curb as your body begins to get rid of inflammation. Urine is one of the ways that you detox, and because we're using an anti-inflammatory program here, you will see your inflammatory levels begin to dissipate. Urine will be plentiful for a while. In addition to the water, you're going to have fresh fruits and fresh vegetables. Do your best to get a variety of colors. Make sure that you're not only eating fruit during the day. 1 piece of fruit would be ideal. In addition to the fruits and vegetables, you can use fish, turkey, lamb. Just make sure that we don't have any shellfish like shrimp. When you're using oils for cooking, please use mainly olive oil if you can. Coconut oil and avocado oil are also acceptable, but olive oil is pretty easy to cook with. Seeds and nuts are fine as long as you're not having peanuts. A lot of mold on peanuts, and we want to avoid that for right now. So seeds and nuts are all in the clear. Because no peanuts, that means no peanut butter, and as a replacement, if you need, you can use almond butter or cashew butter. Something that's a little bit more gritty would be the almond butter, and something that's a little bit more smooth would be the cashews. Because we're not having pork products right now, if you want sausage or bacon, something like that, please aim for a turkey bacon or a turkey sausage. Chicken is also acceptable on the sausage patties. If you do want to have lunch meat, you can be looking at turkey or chicken. Just make sure that it's not the stuff that comes prepackaged at the deli. The stuff that's shiny and slimy, we want to avoid that. If you have the butcher shave it for you right in front of you, that typically is a better option. Once again, note that the recipes that come along with the suggested eating guidelines are examples. You don't only need to make those foods, but they are a helpful starting point. You can let your creativity out, and if you feel like you have something that is worth sharing, go ahead and send it to your provider. I'm sure they're making a database of healthy recipes just like I am. Next, we're going to talk about some of the additional products that your healthcare provider may have decided to add on to your program. Some of these additional products may have been added based off of the functional situation that you're currently dealing with. If you're somebody that has a hard time detoxifying, maybe a hard time having bowel movements, or if you have a long road ahead of you as far as your healthcare journey is concerned, your provider likely will have added something called Binder Pro. Binder Pro is a broad spectrum binder from Biogenetics that has aloe in it, which will allow smooth bowel movements while increasing your body's ability to capture toxicants as they get poured into the small intestine. The small intestine is notorious for being very good at its job, which tends to be absorption. If we reabsorb all of the toxicants that your body just spent time and energy getting rid of, that's like having to do the same work over and over and over again, and nobody likes that. So Binder Pro is an easy add-on that I use with most new patients. Ideally, you're using Binder Pro 1 dose in the morning and 1 dose just before you go to bed. As you sleep, your body is in a rest and digest mode. This allows Binder Pro to work its way through your digestive system. You wake up in the morning and have a nice bowel movement and get rid of all of the trash that you detoxed while you were sleeping. Another add-on that your healthcare provider may have opted to give you is a vitamin D product, especially this day and age with all of the different immune issues going around. Vitamin D3K2 and Liquid D2000 are the two offerings from Biogenetics. If you're currently taking blood thinners, your provider will have recommended that we avoid the D3K2 and we move toward a Liquid D2000. Avoiding vitamin K in that type of a situation is important so that your dosing strategies with your medical provider can remain stable. D3K2 does provide 1,000 IUs of vitamin D per dose, while Liquid D2000 provides 2,000. For those patients that are sensitive or allergic to sulfa-based medications and sulfur itself, your healthcare provider may decide to substitute resveratrol for the Biogen-Max GSH. Biogen-Max resveratrol is a very powerful antioxidant that is wrapped in liposomal technology just like the Biogen-Max GSH is. By substituting out the GSH and adding in the resveratrol, you're still getting that powerful antioxidant technology without tripping any of your genetic mechanisms that you hold. The next add-on that your healthcare provider may have decided to plug in your specific instance is something called omega-3 fish oil. This is a 100% Nordic-sourced omega-3 fish oil with an optimal ratio of EPA and DHA. This is a natural add-on for patients that do have cardiovascular concerns, a family history of cardiovascular disease, or an abundance of inflammation that's requiring just an extra touch. The last potential add-on that I want to discuss here is more of a substitution than anything. Hepato-ST. Hepato-ST is something that will rotate in when a patient has fatty liver concerns. This is something you'll have already been diagnosed with, and it's important to note that Hepato-CL is the product that would be leaving the program, and Hepato-ST will take its place. Next, we're going to talk about some of the common questions that arise. Here's a question: how come all of the products don't run out at the same time? The answer to that is because it was designed that way. The same way that we have liver phases, phase 1, 2, and 3 detoxification, we also have phases in supplementation. Some of the nutrients are utilized in order to ramp up the detoxification effect, And then as we come back down out of the detoxification portion of the metabolic clearing program, we no longer need to push those mechanisms to the same extent. Each product's dosing strategy has been laid out to match an optimal zone of operation. So the rule is, when you run out, all done with it. Next question is what do I do with the remainder of my product? Because each metabolic clearing program, a deluxe kit followed by a basic kit, comes with about 30 days of supplementation, you're going to have a solid week of nutrition left. That week is used for dietary change and intervention as you and your healthcare provider set up your phase 2. Phase 1 is the metabolic clearing program. Phase 2 is where we start digging into your customization based off the findings in your examination and any of the laboratory work that your provider has decided to run. Phase 2 starts at the end of the 30 days. When you begin phase 2, you should have run out of all of the product that you received in your metabolic clearing program. I do advise most patients and most providers to make sure that they don't change supplements and dietary recommendations on the same day, so you can stay organized and headed toward health and healing. As we wrap up today's video, it's important to note once again that inflammation plays a key role in how your body deals with chronic disease. Because inflammation is a puzzle piece to your overall condition, some people will respond more favorably than others. So if you lose 7 pounds and your spouse loses 20, just note that inflammation is likely a larger piece to their overall puzzle than it is to yours. Your healthcare provider will be able to help you organize around that, discover the remaining pieces to your puzzle, and customize a phase 2 to help you create a lifestyle that's compatible with health and healing. The last thing I want to leave you with here today is a reminder that your current health status is the result of your genetics plus your lifestyle. DNA plus lifestyle. Positive outcomes in a lifestyle-based program require a lifestyle that's compatible with health and healing, not one that's compatible with sickness and disease. Thank you so much for watching this walk through the Biogenetics Metabolic Clearing Program. If you have any questions, be sure to reach out to your provider and they'll be able to help point you in the right direction. Once again, thank you. I'm Dr. Watts for Biogenetics.